Hello again. We're going to go over patient and resident safety regulations. This is part of Chapter 13, Section 2, Preventing Accidents and Injuries. So we're going to talk about how you can keep your patients safe legally. How can you make sure that you're providing care appropriately to the right person? Okay. So make sure you don't perform any procedures on patients unless you've been instructed to do so or have proper authorizations. So, as an EMT, we have what's called protocols, where if you see this, you do this. If a patient is experiencing wheezing in their breaths on inspiration, you can, based on certain vital constraints, give them nebulized albuterol, which is a breathing treatment. Usually it's used for asthma, but it can be used when the airway is tightened off. So, but I can't give that to just anybody that says, I can't catch my breath or I can't breathe, right? Because it wouldn't be properly, it wouldn't be within my protocols to do that. All right, so make sure you always follow your instructions carefully and ask questions if you don't understand. Use correct or approved methods while performing procedures, and avoid shortcuts or incorrect techniques. Okay. Make sure you're providing privacy for all your patients. Right? Per HIPAA, we cannot disclose any information unless it's medically necessary or it's for insurance purposes. So we have to make sure that patient's information is not overheard and it's not able to be transferred to anybody it's not supposed to be. You need to be able to properly identify your patient, and you also need to adequately explain any procedure that would be done. Okay. So, anytime you have a patient receiving a procedure, you need to observe them closely. How are they reacting to the procedure? Are they unable to tolerate it? Okay. Make sure you check the areas for safety hazards. If you're in EMS and you're out in the field, sometimes you have to recheck for safety hazards repeatedly because what if you're outside at a park and a stray dog comes up and is irritated or protective? Okay, so sometimes you always have to reassess for safety hazards. Keep in mind your environment you're in. Make sure you observe all safety checkpoints. Okay, so throughout the procedure or before or after the procedure as well. Okay, you need to make sure that you're taking care of your patient, that they have everything they need. Are they positioned in a comfortable position? Do they have side rails that are up? Do they need to be up? Is the bed at the lowest level to the floor? You don't want them to try to get up and then fall out of bed because they thought that they could touch the floor. If you have a patient that's in a gurney or a stretcher, make sure the wheels on the bed are locked to prevent any sort of movement. Okay, so these are the main safety regulations you have to worry about, but I really kind of want to hit on how you provide privacy, because HIPAA is one of the biggest regulations we have in medicine. Now make sure if you're wanting to provide privacy for all patients, make sure you knock on the door before entering any room, even if it's open. Okay, make sure you speak to the patient, identify yourself, and make sure you ask permission to enter before going behind privacy curtains or doors. Once you're in, close the door or draw the curtains before you begin a procedure, before you begin speaking with that patient. Okay, this is not only just out of respect, but it's also part of the rules and regulations in healthcare. Make sure you're able to identify your patient. Okay, especially when you have a lot of patients in an area you can get them confused. Or what if a patient in a hospital room gets up and uses the bathroom, and another patient with dementia or Alzheimer's that's not quite all there comes in and lays in their bed? Well, if you go in there to give the original patient medication, what if that other patient, if they're not properly identified, is allergic to what you'd give them? So there's a lot of things that can happen, and it sounds like a fluke or one-off situation, but these are things that you have to think about that could happen. So I found for like a phlebotomy job, right? People who draw blood. I found this clip that is a great example of how they verify their patient identification, that they have the right person, that they have the information that they need for that person.
Without exception, all patients must be properly identified prior to sample collection. According to the Clinical and Laboratory Standards Institute, or CLSI, proper identification consists of asking patients to give their full name, address, identification number, and/or birth date, and to compare the information given with the information on the request form and ID bracelet if available. Where possible, have patients spell their last name. For inpatients, CLSI recommends asking the same information and comparing it with the information on the request form and the patient's identification bracelet, which must be attached to the patient. Emergency room patients should be tagged with some sort of identification, even if it's only a temporary number. The following should never be considered as reliable forms of patient identification: charts on the wall, water pitchers, or identification bracelets attached to anything other than the patient. Remember, an identification bracelet attached to the bed rail or laying on a bedside tray or table does not identify the patient. Assuming that an unattached identification bracelet belongs to the patient in the bed is taking a chance with the patient's life. There is no substitute for a physical form of identification attached to the person. Avoid asking patients to affirm their name, as in, "Are you John Smith?" If the patient happens to be hard of hearing, he may misunderstand your pronunciation. In one case, a patient who was identified in this manner misunderstood the name that the phlebotomist spoke. The intended patient received incompatible blood and died. Therefore, asking both inpatients and outpatients to state their name as required by the CLSI standards provides added assurance that the patient you are drawing is the intended patient.
So I thought that was a great example of how in healthcare we utilize the standards of identifying a patient appropriately. So just to reiterate a few different items for identifying your patient: check their identification wristbands. It needs to be on the patient, not on something else. Okay, it has to be on that patient. All right. Ask the patient to state his or her name, right? So, like the example in the video, they said that the phlebotomist asked them to affirm the name. Okay, that's where they said, "Are you John Smith?" And they said, "Yeah." Okay, that patient wound up dying. That's a huge problem, right? So it's much better to ask them what their name is and have them tell you and have you verify it, than for you to ask them to agree if it's their name or not. Also, repeat their name at least twice so that they don't misunderstand you when you repeat it back to them. Okay? Check the name on the patient's bed or record. Double check that the person that states their name is the person that should be in that room, that should be getting that medication or procedure. All right, so that concludes patient and resident safety regulations. If you have any questions for me, please email me, bartonj@dearbornschools.org. You can also shoot me a message on Remind. Thank you very much.